And welcome back. Well, when our hormones are off balance, a lot of unpleasant things can happen. Sleep problems, anxieties, sexual dysfunction, so much more.
But there are some treatments that can help both men and women feel better from the inside out. Joining us now to talk about bioidentical hormone replacement is Jessica Schiller. She's a nurse practitioner and owner of Luna Med Spa. Great to see you.
Good to see you.
Welcome back.
Thank you.
All right, so we got to talk about this. I bet a lot of people, I mean, it seems like everybody's talking about hormones lately,
Yes.
whether it's perimenopause, menopause, postmenopause.
Yes.
It's on the minds of a lot of people because they know when hormones are off balance, you're not going to feel great.
Exactly. And hormones are just so important in the aging process. Women's health is so underappreciated, so I think
Yes.
that this is another really important thing, because if you go to your doctor, sometimes they'll be like, you're within the normal limits of the labs, and
Exactly.
but you don't feel good and you don't feel like it. So that's where bioidentical hormone replacement therapy comes in.
Well, I love that you bring that up, because I can't tell you how many times I've talked with friends about that recently, and they go in and they're like, yeah, this is normal for you. And it's like, it's not normal to feel terrible.
Right.
So I'm glad that there's options. So why is it important to be a bioidentical hormone therapy?
So bioidentical hormone therapy, your body, it mimics your own natural hormones.
Got
So
it.
BioTE is who we work with, and we're BioTE certified. And BioTE brand is so important because it's plant derived. So it's naturally occurring plants, and it mimics your body's own hormones.
Got
What's
it.
the process like in trying to figure out if hormones are the reasons why you're not feeling good? How does that work?
So we bring you in, we do some labs in office. We do a thorough consultation and assessment just to see where you're at with symptoms and everything, just to make sure you're a good candidate as well with labs. And then we create a customized dosage for you.
Yeah. How do you know then what each person needs?
It's through the system of BioTE. So BioTE is a great network to be a part of, because
Yeah.
we're not alone in this dosage. So we
Not
go
guessing.
off of, yeah, totally. We go off of a network of people as well.
When
So-
you talk about bioidentical hormones, is it generally estrogen, progesterone, and testosterone?
mainly testosterone.
Okay.
So
Really?
contrary to popular belief, testosterone is the unsung hero in women. It's the most produced hormone, and it actually converts to estrogen. So that's what a lot of women are missing, is the testosterone piece. So yeah.
Interesting. So how does it help? What kinds of things are people feeling when they get their
So
hormones balanced?
It improves sleep, sexual health, libido, anxiety, depression. Weight loss is a really big one. So it helps with all of those things.
Wow,
great.
a
Yeah.
lot. I mean,
A
a lot of
lot.
things it helps with. Is there downtime, or does it take a while
Yeah.
for them to kick in and for people to start to see the benefits?
So everyone's really different. Some people it kicks in, you'll feel it in a couple weeks. Some people it takes a couple rounds to see. It just depends on where you're at with your hormone levels. It's a really easy office procedure. It takes about 15 minutes. And the only downtime is for 3 days you have a bandage on the area where we place it. And we place it under the skin, right in the top of the butt.
Oh.
What kind of age women are you seeing who may be a good candidate to kind of consider hormone therapy?
So it really ranges.
Yeah.
Obviously, perimenopause and postmenopause women, but even women in their 30s.
Yeah.
So after childbirth, and we live in such a toxic world with endocrine disruptors everywhere.
Yes.
So, some women are experiencing the perimenopause symptoms in their 30s, and that can last for 10, 15, 20 years. So
Yeah.
this is just to optimize your hormones and make you feel better from the inside out.
Is it different if you're on birth control or not on birth control for women?
So that one doesn't really matter.
Okay.
And same thing, like we get a lot of women that come in that are already on estrogen, like
Yeah.
patches and therapies. We can switch you over to bioidentical hormones, no problem.
Really?
Without like having a lapse in hormone therapy.
Yep.
So
Because a lot of people talk about creams, that they rub maybe on their
Yeah.
forearm. You mentioned the patch.
Yep.
Yep.
This is different than that. It's
Yeah.
not dealing with some of those things.
and it's more effective because it's a slow release. So it's releasing the right amount of hormone slowly over time. So it's not just like a patch you're slapping on your skin for the week and changing it every week, and who knows how much is being absorbed.
Yeah.
It's a slow release timed, and it's a dosage based on where your labs are at. So it's very customized.
So then how does it work in the long run? Do you then retest after a certain amount of
Yeah,
time
so-
and then adjust?
We bring everyone back at 14 weeks after we place the pellets, and we run labs again just to see where you're at, like in your trough. So
Yeah.
as you're kind of dropping off, because we redose at 16 weeks. So
Okay.
at that time, then we'll decide, like, are we going to retreat you in 2 weeks, or are you still kind of good and we can hold off for a little longer?
Yep.
So that's where we kind of play with it. And that first adjustment period is always kind of where it's touch and go, and we're just kind of making sure your symptoms are all
Yeah.
taken care of and
Yes.
you're feeling good.
What's the kind of feedback you're hearing from your patients who have this and start to notice a difference?
So life-changing is the main one. Life-changing. We've heard things from it saved my marriage to I was asleep and now I'm awake. You know, it's like that internal, you know, you're getting older and everyone thinks that it's normal to just feel like crap, and it's not.
Yeah.
Yeah.
Everybody talks about the fatigue, I mean, everything.
Yeah.
It's like, it's about time, I think, that this is no longer dismissed for women.
For
So.
sure. And I'm so passionate about women's health, and I think it's such an important thing that's so underlooked and understudied, to be
Yeah.
honest. So
Yeah. Well,
I'm really excited.
Congratulations on
Thanks.
Women's Small Business Month.
Thank
Your
you.
month. This is awesome.
Yes, women-owned
Yeah.
businesses are great. We have 12 women that work for us, so
That's phenomenal.
and growing every day.
And you have a
Good for you.
beautiful location.
Thank
so
you.
people need to stop in and see you and check everything out.
Thanks.
We appreciate it. Right now, Luna Med Spa is offering a free initial consultation and exam to see if bioidentical hormone replacement is right for you. But you must book by the end of November. Call 414-448-7148, or for more information, you can visit lunamedspawi.com.